Thank you. Thank you. Oh. Is Department of Health and Department of Education and DOE department are okay? It's really just a relatively simple question, and this is probably based upon my having been in this building for over a couple of decades. When we first started in here, we had smoking permitted in all of our public schools. And I can remember there was a particular principal on the windward side that was a chain smoker and just never without a cigarette. It took a period of time, probably without a lot of support from Department of Education, but with some beginning support from Department of Health, to begin to put into place and ultimately enact laws prohibiting smoking on school campuses. That principal, by the way, retired because he was so addicted he couldn't perform his job without smoking. So we cleaned up our schools on the school campus, but it took decades. And my question to both of you is, why are you not, I'll take this back to your directors and superintendent, why are you not at the forefront of creating a buffer zone around our children in the schools? And I would think you would be up here, or your director or your superintendent would be up at the table saying, there's enough evidence out there that makes us question the health impacts to our children. And I'd like you to take that back to them. And I'd like to have you join those of us that have sponsored this bill and those of us that support this measure to protect our youngsters. You weren't there at the beginning. The outcry on smoking came American Heart Association, others out in the public, and begrudgingly Department of Health first, Department of Education second, joined in. I'd like to see that change with this. We know there's an impact. Those are our children. This is a test project for simply 5 schools. Go back and talk to your heads of your departments, because I hope this bill will pass out and move ahead, and you have a chance then to become part of protecting our kids. Thank you. Thank you.
May I comment? I'm Phoenix Grange. I work for the Department of Health. I'm currently the acting program manager for the Hazard Evaluation Emergency Response Office. I'm also an environmental toxicologist and worked with Department of Agriculture on the statewide pesticide study. I just wanted to respond to a couple of things that you said. Human health and exposure to pesticides and other contaminants is our primary concern. That's Dr. Barbara Brooks' full-time job, is addressing concerns from the public. We do work with the Department of Agriculture, and we also have mandatory reporting from physicians for pesticide exposures. Those calls come in to Dr. Brooks. Anytime someone feels that they have been exposed, we encourage them to call Dr. Brooks at the HERE office, 586-4249. She can work both with patients concerned about exposures and with their physicians to identify what the issues are. In terms of, we testified last year with respect to buffer zones. While in general the precautionary principle is important, it's also very important to figure out where the exposures are rather than having a one-size-fits-all solution. So this particular bill has both the buffer zones, restrictions on what gets planted in the buffer zones, and restrictions on use of all pesticides in that area. There is not, to my knowledge, good science to defend that. what we have been talking about with Department of Ag and are still wanting to see happen are targeted studies to see what pesticides are leaving the sites of use and entering the environment where they can cause exposures to children at schools, to people in their homes, et cetera, and making decisions based on that. When you look at buffer zones in other areas and you look at what EPA does as well, it's very much chemical by chemical, depending on what the individual risks are. So having notification, et cetera, those things are very helpful, but being able to, I just think it requires additional data so we can make science-based decision based on that, both air monitoring, water monitoring, et cetera, so we know what chemicals are of concern and where to move forward from there.
You know, I appreciate that, and the reporting is great, but what would be greater is to put those buffer zones in place right now so the children in Kekaha, and I have a grandson that was there in the schools, that the children in the 5 schools at least don't have to report because the pesticides won't be right by their school ground. We got rid of smoking. It's about time we get rid of the rest of this. Thank you.